Hi there, I'm Emily Goldberg, a genetic counselor with JScreen. Today we're talking about when you should consider BRCA testing. Here's the main thing to know. We usually recommend BRCA testing around the time we can actually do something with the results. That's typically in your mid-20s or older. Why? Because if you test positive, we want you to be able to act on that information and begin screening or take preventive steps. Most providers recommend BRCA testing starting at around age 25. This is when we can begin extra breast cancer screening if needed. For women with BRCA mutations, we often start breast cancer screening around age 25. That's much earlier than the general population, which is age 40. Family history also matters. If you have close relatives with cancer at an especially young age, that can impact your decision. Some couples use the information for family planning decisions. BRCA mutations can be passed on to your offspring, so some couples want to know before starting a family. Testing prior to pregnancy gives you more options to consider. Others test when they're making big health decisions, like whether to have preventive surgery. If you are personally diagnosed with cancer, hereditary cancer testing may happen right away, as the results may help guide your treatment options. We typically don't recommend testing teenagers or very young adults unless there's a strong family indication. Overall, the best time to get BRCA testing is when you're ready to use the information. That's often your mid-20s or later, when screening and preventive options become available. But it's different for every person. Remember, everyone's situation is different. A genetic counselor can help you figure out the right timing for testing based on your family history and life stage. If you're wondering whether now is the right time for BRCA testing, visit us at jscreen.org.